Okay. Good morning, everyone. My name is Suhitha K and I'm a junior here at Frisco High School. I'm going to start off by telling you a little bit about myself. I love to spend time with my family and friends. I have a mom, dad, and an older sister, and I look up to all of them. And I like spending time with my friends, and I like listening to One Direction or anything that has to do with them. And I also love to paint. So ever since I was little, I knew I wanted to become a doctor. That was the only profession that was ever in my hindsight. I would always go to the hospital with my dad and would see how he interacted with his patients and found everything about the hospital environment so interesting and so much fun. I saw the hospital as a place for new beginnings and hope. But ever since I got into middle school, I began doubting whether the medical field was the place for me and if that was the route that I was meant to go in. So when I learned about ISM, I thought this would be the perfect opportunity for me to decide if this was where I should go, if I should go into medicine. So as you all know, there are several different specialties in medicine that all come with different lifestyles and aspects. And if I didn't want too much of patient interaction, I could be a radiologist, or if I wanted to work with kids, I could be a pediatrician, or if I wanted something with more strict timings, I could be a dermatologist or a family practitioner. So initially I wanted to go into neonatology because I loved the idea of being such a big influence in one's initial life stages, and who could ever get tired of looking at cute little babies and their tiny toes and tiny fingers. But I also wanted to go into cardiology because my dad's a cardiologist, so I thought it would kind of be like the family thing, and also a few loved ones to me have been affected by heart disease, and heart disease is the #1 killer in America right now, so I thought that if I become a doctor, I'd want to become a cardiologist and treat suffering or abused hearts. So during our first semester of ISM, we were required to conduct 5 informational interviews with professionals in our field of study. So after I finally gathered the guts to make my first phone call, I got an interview with Dr. Lynn Mahoney, who is a pediatric cardiologist at the ambulatory center. She is an elderly woman but was so energetic and passionate about pediatric cardiology, and she had such impressive measures, such as going to Stanford University and UT Southwestern. And even to this day, she continues researching and writing articles about pediatric cardiology. So it really inspired me and showed me how passionate one should be about their job. And my second interview was with Dr. Adam Shapiro, who is an electrophysiology cardiologist at the Heart Hospital of Baylor Plano. He was such a soft-spoken man, and it was easy to see that he was such a great doctor through his communication skills and subtleness. The most important thing I learned with him was the importance of bedside manner and how important it is to have connection with each of your patients. Then I had an interview with Dr. John Osborne, who was admitted into medical school at the young age of 18, and he graduated from Harvard residency at Brigham and Women's, which is one of the most prestigious residency programs in the country. And he really taught me that it's important to be an example for your patients. You can't just tell them to eat healthy and exercise if you don't follow those rules yourself. And then I had an interview with Dr. Srinivas Patluri, who explained his entire life story and how he got into the field of medicine. And this interview particularly had the most impact on me because he shared several stories on how he became a doctor. And one of the stories that really stood out to me was he told me how when he was growing up, his grandfather had told him that he would become a doctor. So naturally he went into medical school, and after he got there, he realized that he didn't really like medicine. He thought it was boring, and he wanted to be an engineer and do something more with his hands because he was a tinkerer. So he went and he told his dad the situation, and his dad was completely supportive of him. But he said, I request you to, complete your last couple of years in medical school, and if you really don't like it, then you can go into engineering. So he listened to his dad, and he followed through, and he realized that medicine was his passion. And he went into interventional cardiology and got his hands-on experience and everything, and throughout all this, he moved to America with his new wife, and he had to balance his family life and finding a job at a hospital and everything. So it was really inspiring to me, and it showed me that even if things seem hard, that you should keep working at it, and that you should follow your dreams. And my last interview was with Dr. Sam Wilbert, who was also so kind and gentle. His friendly nature made it easy to have a conversation with him, and he emphasized the importance of being passionate for whatever field you go into. Throughout all my interviews, the most important thing I learned was that the most important ingredient to become successful in any career that you go into is to be passionate. So I hope that throughout the end of this, I realize that I hope that I am as passionate as I think I am for cardiology. And throughout my interviews, I began to research statistics on cardiology and saw the number of heart disease deaths was drastically more significant in Mississippi than any other state in the country. So based on this, I decided to make my research objective to compare how geography can affect the incidence rate of heart disease among residents in Mississippi, a state with very high incidence of heart disease, compared to Utah, a state with relatively low incidence of heart disease. We all know that heart disease is brought by a combination of factors including diabetes, size of arteries, diet, lifestyle, exercise, and family history, but despite this knowledge, this condition seems increasingly difficult to prevent and control. So I thought, is there another factor that we're overlooking, or is there something else that plays a lead role in causing heart disease that we're not aware of? So when trying to research patterns in heart disease in hopes of uncovering new and helpful information that could help us better understand how heart disease comes about, I began looking into an unlikely factor, geography. At face value, it seems as though the city or state that you live in may have little impact on your personal health. However, when one takes a look at the distribution of heart disease across the United States, a startling observation is made. While some states seem saturated with cardiovascular disease, others seem relatively devoid of the condition. So my interest is in discovering if there is any environmental factors such as weather, pollution, or greenery that are playing a more significant role in causing heart disease. And yeah. So in conclusion, I look forward to continuing my journey in ISM and learning more, and I look forward to finding a solution to my questions. Thank you so much. That's it.